I want to go across first for a general overview to Dr. Trehan to try and explain to people watching at this time how dangerous the behavior that we're seeing is. I understand people have been locked in, they're frustrated, everybody can't have a private villa, and therefore very naturally people need to get to places which are more commercial and therefore more busy. How scared are you by the screens, by the images that you're seeing on the India Today screen, Dr. Trehan?
Of course, the images are very disturbing, Rahul. The basic thing is that we've always said, when the question is asked, when will the third wave come and how bad is it going to be? So it's very simple, 3 points that actually will determine what and when the wave will do. And at the timing normally between the first and second wave was 32 weeks. Now, do we have 32 weeks? It depends on so many factors, but most importantly, 3 factors being: one, public behavior, which you're seeing now is very disturbing because actually the second wave is not over. It's just that relatively it's come down from 4 lakhs to 43,000. So it's still very much around. The second part is that vaccine is the only defense that we know today that can help us to mitigate the third wave. So the race to vaccinate has to be accelerated. There is some data from the government that says that the availability of vaccines will be exponentially ramped up, as by the end of this month and August, September, October onwards, we'll have plenty of vaccine to vaccinate. And the third is the government regulation. Now, local governments, it was left to the state governments to actually decide what they will allow and what they will not allow. So there is always this pressure of the economic conditions of the people in the state, that especially like you see the holidays that are happening today. Now, could it have been measured from the beginning? Yes, it could have been, knowing very well that if you let in thousands and thousands of people, that these kind of scenarios will develop. Now, what the fallout of all this will be, because you must be aware that the new variants are obviously more dangerous. If you look at the chart, the new waves in the US, and they say unvaccinated states, that is about 50%, or low vaccinated states, are seeing a surge.
Okay, so hold that thought.